Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Hello and welcome to the latest episode of POMA Does podcast series sponsored by the Pennsylvania Osteopathic Medical Association. I'm Syed Aryan. I'm a PGY2 at the LVHN Schuylkill Family Medicine Residency. I'm privileged today to be joined by Dr. Bull and Dr. Chatpar. I'd like to start by asking each of you briefly to share your reasons of practicing in a rural setting. And can we start off with you, Dr. Bull?
Hello. My name is Dr. John Ball. I'm the program director of UPMC Rural Family Medicine Residency and also a assistant director at UPMC Williamsport Family Medicine Residency. And, I've always wanted to work in an underserved community since I was in grade school, and having grown up in a rural community, it really fit well for me to work in and develop into a rural physician. I went to residency in Williamsport, Pennsylvania after going to medical school at Philadelphia College of Osteopathic Medicine, and then had a National Service Corps scholarship and went to Eastern Tennessee for 10 years where I did full spectrum family medicine, and then came back in 2012 to UPMC Williamsport to teach. And over the last 4 years, we've started a rural residency that's kind of integrated in with the Williamsport program. And we're real excited. We just started with our first class this past July. And I think the main reason why I really enjoy rural medicine is because of the relationships that you can develop over multiple generations with your patients and the continuity that you can have with them. Half of my practice now is actually doing home visits in the Amish community, and I feel the same kind of joy when I go out in those visits as well as what I experienced in Tennessee.
And Dr. Chatpar, would you be able to introduce yourself and tell us why you practice rural medicine?
Sure. My name is Mohit Chatpar. I'm a third-year family medicine resident at Indiana Regional Medical Center in Indiana, PA. It's on the western side of Pennsylvania, about an hour east of Pittsburgh. I'm originally from New York. I went to undergrad in New York City, and then I decided I wanted a change of scene and pace, and then I decided to go to Mississippi to do my master's program in biomedical sciences, and then I decided to stay there for medical school at William Carey University College of Osteopathic Medicine. And when I was there, I really liked the rural communities because that was something I never saw before. I love the people, the interactions, just the close-knit community that rural communities have. And then I decided to come back to more rural area here in Pennsylvania, closer to more family that's in the northeast of the country. And where I am now, I really like it a lot. Our clinic or residency clinic is about 20 minutes to 25 minutes outside of Indiana, PA, which is already a smaller town. But right outside is more rural communities, a lot of farmers, a lot of coal mining. Just the connections I made with these patients has been great. I love to know more about them, their families. I treat a lot of their family members, which is also great to see. It's not just one person isolated, but they also sometimes come as a group. Sometimes it's like the grandmother, the mom, the granddaughter, and I've even seen great-granddaughter at the same time. So that's been pretty cool to see all at the same time in our clinic setting as well as in the hospital setting. And I really liked being part of the community. I feel everyone's been pretty welcome and open to physicians in rural settings just because there aren't as many people practicing in rural areas. So I really feel that it's a great opportunity for people to branch out, expand their horizons. Also, the food is great. Cost of living is low. The rent is low. I can't complain too much.
It seems like most of us have at least had our training in larger cities. What would you say are some of the difficulties or challenges you face when transitioning to a rural area, both as far as the community goes and as far as their practice in medicine?
For me personally, I trained in Philadelphia for medical school and then transitioned out to Williamsport, which is a rural area, although the actual town is considered urban. Some of the hard things are just identifying what resources are available in the communities. And, we found that rather than having multiple Dunkin' Donuts around, we might only have one, and it's a little bit different. Going to Eastern Tennessee was even more of a challenge in some ways because of the scarcity of resources there. But on the other hand, as a physician going to those communities where there is a lot of scarcity, it's just really, even though it's a challenge, it's also really a blessing to the community because you can actually make a difference in that small community just simply because you were there. And it really brings such a rewarding experience from that, the ability to actually know that, if you were not there that day, those patients would not have had the care that they needed. They would have had to go across the mountain to another community in order to get, medical care. And it just makes it very meaningful.
Yeah, I agree with that. I think just scarcity of resources is a big issue, but what we've seen in our area. Transportation is not a big issue for getting patients to go to another facility that does have those resources, because it could still be about 40 to 60 miles driving distance away, but sometimes they don't have transportation to get there. Timings don't line up with the clinic we're trying to send them to. So just coordinating that is also a little bit challenging. When I was in Mississippi, one of the towns that I did my rotations in, there was no psychiatry in the span of 90-mile radius. So that was also a big challenge, just to get someone to come down to see patients that would come once every 2 weeks. If you didn't catch that psychiatrist that one day they were going to be there in a span of 2 weeks, you would be missing out for a whole extra 2 weeks. Not for an issue of appointments, but just they weren't even there for you to see them. Another thing I've seen is also some rural areas might not always have the best internet or telephone network coverage. So it's also difficult to do telemed or teleconferencing to even help them in that respect. I think it's getting better, but it's still not as perfect as it should be or could be as it is in the urban areas where there's Wi-Fi everywhere. Those are some of the big challenges that I've seen.
One of the things that was probably most surprising during my intern year was just seeing some of the social determinants of health, some of the problems with the drugs, problems with poverty, patients not following up with or having a primary physician for decades and suddenly ending up in the ER bay. So can you talk a little bit about whether you've had similar experiences where you're practicing?
Yeah, I totally agree. Social determinants of health are one of the most significant medical care in the rural communities. And I think it was the American Academy of Family Physicians. They have a graph of, what contributes to health outcomes like birth, infant mortality and life expectancy. And 20% of it is access clinical care. The other 80% are things that are outside of our control, like the social determinants of health. And there's been a lot of articles written about this and what it looks like in rural communities. And you can see the impact of those social determinants of health and on healthcare disparities and health disparities. And, ultimately what our goals are with our patients are to bring them health equity. And that's the whole reason that we're working in these underserved communities. I would have patients that would walk several miles to see me. You would actually go to recommend a diet and they would not be able to afford the food that is recommended, kind of a food gap between what they can afford and what the actual guidelines say. By working among the Amish, they don't have health insurance. So it's another large social determinants of health. And, the multi-generational poverty that I would see in Appalachia, some of the rural communities, you would have communities where people, they didn't even know how to access the healthcare that they needed in a healthy way or a way that actually was positive for their outcomes. And, there's an article that Donald Berwick wrote called The Moral Determinants of Health. And in the article, he highlights the fact that, if you look at social determinants of health and the train stop or subway stop, look at life expectancy, that you can see the impact of place on, the outcomes and life expectancies for patients. But yet, if you look at heart disease, which if you took away all heart disease, there would be an improvement in life expectancy of 4 years. But if you took away all those social determinants of health, there'd be an improvement of 16 years, which means it's a significantly larger impact on life expectancy. And I think that we as physicians in the future are going to be more and more focused on developing our communities and addressing social determinants of health than what we were ever in the past, because as we realize that impact.
Yeah, I agree with that as well. We did an exercise seeing how much we could afford to buy for groceries for people who already could not afford much on groceries, and just coming up with the exact amount of money to spend or the amount of days you would need to use those groceries was challenging enough. But getting the best nutritional value from them was also very challenging from us, from people from more of a viewpoint of what is nutritional versus not nutritional, what is healthy versus not healthy. So think about the patients that might not know that education in the first place. that would be a lot more challenging for those patients. I got to learn about subsidized housing, how they're able to afford housing with the help of government stipends. But even that is challenging because not every apartment complex even accepts the subsidized housing amounts from the government. So that's also a challenge to even find places that will accept it. Getting transportation to be able to go to work. They can get a job, but they can't get to work. They can't earn money to do anything else. So that's also another challenge that I've seen with the social determinants of health. But just working with that and working with our social needs and people at the hospital has been helpful, but still it's a long way to go for that too.
Yeah, I'd probably say my number one referral is to population health to get patients in touch with social workers who are excellent at what they do. But I feel the same. Sometimes it's, just an infinite loop, and patient at the end of the day is the one who suffers the most. But on a different note, despite all of these challenges and issues that our patients face, what would you say you enjoy most about rural medicine?
Well, my wife and I, when we moved to Tennessee, we moved to a very remote town of about 2,500 to 3,000 people. We lived there for 10 years. And what was phenomenal there was just that our community really accepted us and kind of adopted us. And the older lady across the street became our Tennessee grandmother. And, we were only there a few months, and the community is so welcoming. They actually just will walk up on your front porch and kind of start chatting. And one of my patients brought his guitar over and sang a song for us on the front porch. And after we had lived there for a couple of years, we actually started a community garden on our property. And we had that there for 4 years. And it really got us involved with the community. And I think that's the most rewarding thing, is just the ability to almost be adopted into a community and to see the fruits of that labor with them and see people change. It's really phenomenal.
Yeah, I agree with that. Just getting to be part of the community, being welcomed and accepted has been huge for me. Just being able to go out anywhere and just happen to run into a patient and see how they're doing, what's going on, because we might see them once every 5 months to a year, but you see them once in a while out in stores, grocery stores, out in the market, out just around town. It's just a great feeling for them to say, hi, how are you doing? Just hearing more about their lives, what's going on with them has been great. One of our patients owns a corn farm, so we got to go fresh corn picking at his farm. So that's pretty great experience as well. I tried fresh picked corn for the first time, and I can tell you it's amazing. I never had that kind of corn before, so definitely recommended if possible.
Yeah, our program does a pretty good job about community integration. We try and get out to the local high schools and talk at, some of the social events, and just showing face, I think, gets you to become closer to the community. I also have some children who play soccer, so I'm in touch with some of the sports teams and other sports parents. So that's always nice to get integrated that way. I think one of the reasons that I joined or applied to several rural residency programs was this idea of practicing full scope family medicine. So could you tell me a little bit about what your experiences have been, and do you feel that you're able to do so?
Yeah, so my experience was that I chose to come to UPMC Williamsport because I really wanted to do full scope primary care family medicine in a rural community. And I ended up for almost 20 years practicing and delivering babies. But in Tennessee, my experience was, in fact, it was pretty amazing. I would see patients in the office and be on call at night. And, you would have a laboring patient or somebody who would get admitted to the hospital. And it wasn't uncommon that when I would get to the hospital for that delivery or to admit that patient in the ICU, that there would be someone else there that I would have actually also cared for, but I had no idea that they were related. And it was very rewarding to be able to provide that continuity of care through the hospital system, and also to provide, prenatal care and actually then be able to deliver a patient and then follow up the baby and the mom in our office as well. And there really isn't too many experiences in life that are quite that joyful as being able to follow patients like that.
Yeah, from my standpoint as a resident, I've done rotations all in different departments around the hospital and the clinics. And it's great to see patients from our own clinic that we get to see in other departments, like in cardiology clinic or pulmonology clinic or dermatology even. And then if I happen to be in the ER rotation, then I might see them come to the ER or get admitted to the hospital. I get to treat them at the hospital. They already know who I am. They're more comfortable with me. I know their history, their story. So I feel that provides a lot better care, a lot better continuity as well. I've delivered a lot of babies. It's been a great experience as well to see them and then take care of their parents also at the same time. So it's a great experience being part of that full scope experience.
Yeah, I can also attest to that. I think primary care is usually the first type of residency that pops up in rural communities just because of how essential it is. And they're usually unopposed programs. So when you're in the ED, you're the ED resident. And when you're on OB, you're the one assisting with C-sections and delivering babies. And so I feel like that experience is unmatched. One of the other things I wanted to touch on was some advice for potential future residents or current med students who are probably getting ready for the interview process. What sort of advice would you have for our current med students who are contemplating whether or not to apply to that rural program? And what would you suggest would make a good candidate?
Yeah, I think to answer your first question, what advice I would give, I think one of the things that people don't realize is that you really have to look at what your end goal is and where you want to practice after you get out of residency. So I'm sure there are people there that are skilled enough that they can just kind of skate through without a lot of preparation, but really you should be thinking about where do I want to practice and what does the impact of that practice have on where I train? And so when it comes to rural family medicine or rural medicine in general, being able to train in a place that has some scarcity is really super important, because the ability to understand how to use resources to the maximum, how to be a leader in your clinic for when you get out in practice, how to do full spectrum care, how to understand how to negotiate all the dual relationships that you'll have with your patients. There's just so many things that, a rural family medicine practice, that skills that you need, that gaining them in a rural setting would be really helpful. There are also some very good studies looking at where physicians end up practicing, and there's definitely a relationship between where you do your residency and where you will practice in the future. And one of the big problems we've run into in rural medicine is that a lot of the residency programs are in urban settings. And because of that, it's been really difficult then to get people kind of recruited out into those rural areas. And so for our program, and I believe your program there in Indiana as well, our rural program was started by a federal grant in order to start a rural program to try to address that. The other thing I would say to somebody, who wants to go in kind of the second half of your question there, who wants to go into a rural area, is that you have to be really deliberate about your preparation. And so that means that, when I was preparing to go into a rural setting, I tried to get as much of a broad-based training as possible, because I knew that there would not be somebody right down the road that would be able to kind of fill in or tease out that differential, because it just wouldn't exist, that physician that you might be able to kind of bounce things off of or refer the patient to. So you really have to be a very good physician, in a broad fashion. And so studying as broadly as possible, experiencing different rotations across different specialties is really important. I also was able to do a rotation out in a Navajo Nation, which was really helpful to see what family medicine is like there, and one global rotation as well, one on the border of Mexico, for the same reason, to try to gain that experience.
Yeah, I would say in rural areas, you kind of have to know how to manage everything. If you go to a rural place and learn that, then it'll help you in the future, whether you're in a rural place or not a rural place. If you don't learn that stuff now, then it's going to be harder if you happen to go to a rural place in the future and you don't know how to manage it. You could try referring, but like I said before, there's no one for them to go see for some time, or it's hard for them to get transportation. Then you're kind of stuck in terms of trying to help that patient. Then you're not doing your duty and giving the best care that you could give to that patient. So it's always important to at least know more in training, so that later on in the future, you might not need to use it, which is fine, but at least you know how to do it if you happen to be that person that needs to do it. In terms of preparing for where to apply to, I would say the best thing is to go rotate out of one of those programs that you might be interested in to see what it's like, just because it's different on talking to them on Zoom or looking at their website. But if you happen to go there in person, you know exactly what the atmosphere is like, you know what to expect. And even if you don't audition or do a rotation there, I would still recommend to do a rural rotation somewhere just to get that experience. Same way how when we apply for medical school, you shadow a physician beforehand to see what medicine is like instead of just going in blind. So the same way I would say to do that, go to a rural location or area or practice just to see how is it different from what you're used to in general.
Yeah, and I'll add on, I think it is a great piece of advice to get as much experience during your medical school training, especially in a rural setting, just because I feel like a lot of the attendings that I've worked with aren't used to having residents before our program came up. And the more knowledgeable and confident you are in your diagnosis and your hands-on skills, the more opportunities and doors that are going to open themselves up for you, and the most you'll be able to make of your training. I think also one thing I underestimated was the amount of psych I would be dealing with in the office as far as, anxiety and depression. Definitely MAT therapy. If you could go out to a rehab center or some sort of alcohol rehabilitation and get some experience with dealing with patients that just got out of rehab and showed up at your clinic. I think those are some of the things that probably would have better prepared me for my first year, but you will get a lot of that training from the doctors that have been doing it for a while. So in summary, I'd like to thank each of you for your time, Dr. Bull and Dr. Chapar. Thank you for joining us tonight, and stay healthy.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.